Okay, students, so we have landmarks of the face and oral cavity. Okay, so as landmarks, you must thoroughly be familiar with the landmarks of the face and oral cavity. Okay, it'll be a useful reference for your junior year when you're studying dental radiographs and how to mount these x-rays on the dental x-ray mount. And also for facial features, landmarks have many deeper structures, so you need to know when you're these landmarks. So when you're looking in your patient's mouth, so you can realize and you can pinpoint any type of pathology or, in other words, abnormalities. Okay, so landmarks of the face. Okay, we have our forehead. All this you should know from the previous lesson on head and neck anatomy. So you should know the forehead, the temples, the orbital around the eye, the external nose, the zygomatic or molar, which is the prominence of the cheek, mouth and lips, cheek, chin, and external ear. So you should already know about these landmarks. So we're going to go a little further into these landmarks now with this lesson. So we have the outer canthus and inner canthus. Okay, so that is the corners of the eye. We have the ala of the nose and the philtrum. Tragus of the ear. Okay, we have the nasion, the labella, the root, and the bridge, which I'm going to go over later, and the septum and the anterior nares, and the mental protuberance of the mandible, the angles of the mandible, and the zygomatic arch. So this is a competency that you're going to be at the chair. You're going to have a patient. You're going to find one of your fellow students, and you're going to be pinpointing these landmarks. Okay, so the lips are also known as the labia. The lips are outlined by the vermilion border. So I'm going to give you an example of the vermilion border, how some women, they take this pencil and they outline their lips first before they put on their lipstick. So this is the vermilion border. So the labial commissure is at the corner of the lip, and the nasolabial sulcus, this is this groove between the nose and the mouth. Okay, so we have a picture here. So we have our philtrum right here. It goes in. Here's our vermilion border. Okay, labial commissure. So this nasolabial sulcus, it's here and it goes all the way up to the nose. And this is the thing that as you get older, some of these women, they complain about this laugh line. This is the nasolabial sulcus. Okay, the oral cavity. So the oral cavity is lined with a mucous membrane tissue. It consists of two areas, the vestibule. So when you close your bite down and you push your cheek out, that area between the teeth and the cheek is the vestibule. The oral cavity proper is within the upper and lower dental arches. So it is your teeth, it's your maxillary and mandibular and the teeth. Vestibule, like I said, the vestibule begins at the inside of the lip and extends from the lip into the alveolar process of both arches. And we're going to have a picture, so I'd rather show you the picture to explain this, and the mucogingival junction. So here is the mucogingival junction right over here. See how it's different over here? So here is the attached gingiva, and here is the unattached. It's a soft tissue. So you can see the line of the mucogingival junction. So this is a sulcus. When you floss your teeth, doesn't the floss go below the gum line? That's the sulcus. Then we have an interdental papillae. This is the gingiva that's sticking out in between your teeth over here. It's like a triangle. Okay, I just want to go back to this here for 1 minute too. I just want to show you what normal gingival tissue looks like, okay? I forgot to mention that earlier, okay? Okay, so here's our vestibule. So the vestibule's in here. This is like the oral cavity proper here. Oh, here we have here. This is the frenum, this little muscle attachment. This is the labial frenum here. And you can see the difference in color between that. Here's the mucogingival junction right here. That's the oral mucosa right here in the cheek, and the attached gingiva that's on the mandible. And here it is on the maxillary. So this gingiva is attached to the bone. Then we have our soft mucosa here. Oh, I see some more frenum over here. All right. So here's our buccal frenum. So frenum is this muscle attachment. between two structures here. So we have our buccal frenum. This is the vestibule now. This is the vestibule. Here's our duct from the parotid gland right here. Okay, so this is what a vestibule is. Okay, so I just showed you some frenum, the labial and the buccal frenum, band of tissue. I just showed you that. Characteristics of normal gingiva. Okay, it's around the tooth. It's pinky. It's not really red, and when it's dry, it appears to look like an orange. Okay, when it's dry, and it has an attached gingiva, and they have the interdental papillae, which is the little triangle piece of gingiva in between the teeth. So here we have our normal. I have no idea what this is, but this is what the normal gingiva will look like. And its pigmentation is different from individual to individual. Okay. So here we have our mucogingival junction again here. We have our labial frenum. Here's a buccal frenum here. It's not labeled. Okay, so here's another name for that papillae, interdental papillae. It's also called the interdental gingiva. So this little triangle here that when you floss your teeth, your floss touches it. Okay. And this here, this is called the linea alba. It's a line that's on the cheek, the buccal mucosa. Not everybody has this. It's right on the line of the maxillary and the mandibular occlusal surface. So it's right here. So when people bite their cheek, that's what I'm thinking, that it's this little raised area. It's white, and it's called the linea alba. Okay, and unattached gingiva, known as marginal gingiva. This is where you floss your teeth. Okay, when you floss and it goes below, okay, it's about 1 millimeter wide. Okay, and it's called the gingival sulcus. Remember that. This is the gingival sulcus. There are other sulcuses as landmarks, but I want you to remember the gingival sulcus is the unattached gingiva around your teeth. It's collar-like. And let's move on to the interdental papillae. Okay, so the interdental papillae is also known as the interdental gingiva. That's that little triangle of gingiva between your teeth. When you floss your teeth, the floss touches this. And let's move on to the oral cavity proper. That's the arches, the maxillary mandibular arch. It goes from the central all the way down to the last molar on each side, and it links the vestibule. So you know the vestibule, that space. Okay. Okay, so we have our hard palate. It separates the nasal cavity from the oral cavity. It has respiratory mucosa, okay? And our mouth has, the oral cavity has all mucosa. I just want to make sure the two different tissues here. The mucosa of the hard palate is bound to underlying bone, so that when someone gets an injection in the palate, it's very painful, meaning that the bone is like right there. There isn't any soft tissue for the fluid of the injection when it's being penetrated through the gingiva. So landmarks of the hard palate. So this is important. These are two things that you need to identify for me. Is the incisive papillae. That's behind the centrals, 8 and 9. It's like a little bump. And we have the rugae. This reminds me of the wings of a butterfly. So think of the rugae as the wings of the butterfly, and the incisive papillae is the body of a butterfly. And we have palatal glands, which those are the little minor salivary glands, but not really going into it, but I want you to know it's there. Okay, so we have the soft palate. So the soft palate, the really only thing I want you to know is it has this uvula, that little punching bag. So the soft palate ends posteriorly, and there's a free edge with a hanging projection called a uvula. Okay, so landmarks of the soft palate. Okay, so bottom line here, I just want you to know the walls of the opening in the back of your mouth, that's on either side of that uvula. The isthmus of fauces is just a fancy word for your tonsils. Okay, so the fauces, there are a lot of different soft tissue back there, but your tonsils are called the isthmus of fauces back there. And here is one of the pictures what I just talked about. So we have our incisive papillae, which is the body. I want you to think of it as a body of a butterfly. And here's the rugae, which is the wings of a butterfly. So here's the incisive papillae, and here's the rugae. So I want you to know these are the minor salivary glands over here. Okay, and here is a surface of the soft palate. As you know, there's a lot of different tissue here, but I just want you to know here is our tonsil. Okay, so here's our uvula. And like I said, the isthmus of Fauces, just a fancy word for our palatine our tonsils. Okay, so gag reflex. Very important to know where the area of this gag reflex is, especially when you're in your junior year and you're starting to take dental radiographs. Okay, it's a triangle. It starts at the top of the mouth. It goes down on the side of your tonsils, your isthmus of Fauces, and across on the back of your tongue. You have to be really careful to stay away from that because it does. If you touch it, it does trigger a gag reflex. Okay, so speech, the tongue, very important for speech, moving the food and positioning of food, sense of taste, swallowing, and cleaning of the oral cavity. So the tongue has really a lot of important functions. Parts of the tongue, you have our body, you have the root, the dorsum, sublingual surface, and the lingual frenum. So what I'm really going to be talking about is the sublingual surface and the lingual frenum and the dorsum of the tongue where the taste buds are located. So the taste buds are located in two different areas, the fungiform papillae and the large violet papillae. So over here on the tongue, these two locations, that's where the taste buds are located. And the sense of touch is provided by the filiform papillae. Okay, it covers the entire surface of the tongue, the filiform papillae. Okay, so we have our filiform papillae here, and here's our fungiform. Okay, so filiform papillae is for touch. Okay, here's our lingual under the tongue. So we have our lingual frenum here. We have our lingual veins. And remember the dots here for the submandibular gland? Right over here. Okay, and this here is, I believe, is going to probably be the last slide on this lesson. And it's going to go right into teeth, either single-rooted or multi-rooted. They sit in bony sockets, so the bone around the teeth are called the alveoli. And the cup of gingival surrounds the tooth unattached gingiva, so you know that is the gingival sulcus, right? And the portion of the tooth that is visible in the oral cavity is called the clinical crown. So when you're looking in someone's mouth at the tooth, what you're looking at is the clinical crown. Okay, like I said, this is the last slide for this lesson. So I just want you to remember this here. Bony sockets, the bone around the roots are called the alveoli. Unattached gingiva, another word for the unattached gingiva. There is a gingival sulcus. And when you're looking at a tooth that's visible in the oral cavity, it's called the clinical crown.